Hi, this is Aaron Patzer, the co-founder and CEO of Vital, with an overview of our AI-powered patient experience suite. I have a tendency to think that modern healthcare is really good at saving people's lives, but not so good at engaging and educating patients and their family members. And that goes for during the actual physical visit at your hospital or your clinics. And that's what Vital solves. We sit on top of your EHR, looking at everything that's happening behind the scenes and communicate that out to patients. It starts out with a text message. If you were in the emergency room or something, you would get an invite, welcome to Summer Health Hospital, see your wait times and more, click here. This is a unique link per patient. There is no download. This is a progressive web app. So secure, confirm your last name and date of birth. It's in English, Spanish, Vietnamese, Somali, any language that you like. It'll look like your hospital. It'll make AI-powered predictions of your wait time for triage, show you how busy the emergency department is, show you what's coming up next. So what is assessment? How do they make decisions here? What are some things I can do to make my visit go faster? Early urine collection. Be prepared with your home medications before you talk to the doctor. Pinch and zoom maps to find my way around the facility. It's going to move forward automatically once it sees a triage note being written in your EHR. Extremely high adoption because we make it easy. About 60% of all patients use this, 75% in the pediatric case. You're going to wait for 40 minutes to an hour. These wait times are 95% accurate. In the wild, we've spent years making sure that these work well. They look at everything about your facility, and they also look at the patient. So it actually will use the patient's age and vital signs, reason for visit. So two people who walk in at the same time may see different wait times depending upon whether they're elderly with chest pain or a young person with a broken ankle. You can share your visit with family members. So I can send a no PHI visit to a friend or to a family member. I can see my brother in the ED and where he's progressed and how many lab tests he might have back. Heavily utilized by family members, especially in the pediatric case. If one parent is not there, they almost always share with their spouse. It'll apologize if you've been waiting too long. That actually really helps elopement and people leaving without treatment. If you have the staff to do it, you can do these push button call requests. I'm cold, I'm thirsty, I'm in pain. Those get routed, instead of nurses who get asked to do too much, to lower paid techs and patient care people. With test results, we have videos that show you what is urinalysis. We show you that BUN, instead of 26 micrograms per deciliter, it explains it, what it is. It measures your kidney function. If your lab results are abnormal, they can be hidden, or they can be delayed by 30 minutes, or they can simply be explained. What's a high white blood cell count mean? What's it used for? There's thousands of pages of content in multiple languages here. For radiology, we go even further. Your normal x-ray is absolutely not understandable. So I'll show the original note. You have a fracture of the lateral and medial malleolus. I don't even know what body part that is. We have a generative AI system that translates that into, you have 3 broken bones in the ankle. You can use this at vital.io/translate with your own notes if you want to give it a try for yourself. After you are discharged, I'll show you how you can schedule. It'll give you a breakdown of everything that you're supposed to do and not supposed to do. Use your crutches for the next 6 weeks because you broke your ankle. You need to schedule with an orthopedic surgeon by this date. You need to schedule with a primary care. You need to pick up your medications. Here's where they're sent. It's hard to get an appointment. So instead, we look at everything that's in your discharge, all of your diagnostic codes, and we make like an AI find a doc, the best doctors for your specific condition who speak your language, live near you, and prepare a custom list for you. And we'll actually go out and schedule, attempt to schedule with multiple doctors, and it's the first one who picks up who gets that schedule. And then on the inpatient side, it's also has all the sharing and all of the tests. It'll show you what's happening for today's care. You can order food if you want and place that order. You can see how you're recovering over time. Your vital signs were abnormal and now they're normal, or your lab tests have gotten better, and it actually makes a distinction day to day. It'll assign patient education for you automatically. If this person fell and broke their hip, it'll talk about fall prevention and the total hip replacement that they're about to have. On the second day after they've had that, that's going to get changed to get up and moving after surgery or after your joint replacement surgery. All of this happens automatically. AI does the work so that nurses don't have to. This reduces a lot of staff burden. We've shown that it increases not only staff satisfaction, but staff retention. And the inpatient product, I think, saves 2,200 hours of nursing time a year. The ED patient reduces left without being seen, left without treatment, elopement, reduces bounce backs. I'm going to make sure that people adhere to their instructions in a much more reliable way. All powered by AI. Talk to you soon.